This program contains medical images. Viewer discretion is therefore advised.
A cataract is a clouding of the lens inside the eye, which leads to the loss of vision in the affected eye. It is the most common cause of blindness and is conventionally treated with surgery. Visual loss occurs because opacification of the lens prevents light from passing through and being focused on the retina, which is at the back of the eye. Cataract occurs commonly with aging. However, several other causes of cataract exist. Did you know children can be born with cataract? Can bleaching cause cataract? For answers to these and more, join us to live through the experiences of cataract patients.
Welcome, lovely viewers, to another exciting episode of the most educative health program on television, and I mean the OR Show. My name is Dr. Titus Bayo, and as usual, it's my delight to take you into another theater to learn about another condition that has surgical components in its management. Today we are looking at the eye. The eye is so important. Without it, we are unable to see and we have a lot of challenges. And so we must do everything to guard and to protect the eye. So today we are going to learn about one common eye condition and how it is managed.
Bismarck, what I talk about that I have a eye problem, which the doctor told me is a cataract. So they have to do me surgery before I will be okay. So as such, they refer me to this place.
We are already in the eye theater of the Rich Regional Hospital, and I have in my company Dr. Natalie Gladys Akon, an ophthalmologist. Doc, you're welcome.
Thank you. Thank you very much.
Okay. So doctor is going to take us through everything we need to know about cataracts. You've heard that name before, I'm sure. You want to find out, does it affect children? Does it affect adults? Who can be affected? How do we treat it? And all of that. You can join the show via social media. You can go to facebook.com/the OR show as one word. And then you can post your comment there and we'll read it and get answers for you. Well, we'll zoom in directly into our discussion. Dr. Akon, what are cataracts? We hear the name several times. What are cataracts?
Cataract is a partly blinding condition,
Okay.
which is mostly occur with the age, but it's also occur in early stages. Sometimes people used to be born with the cataract.
Oh, really?
Yes, even that's why sometimes in the small children, you can hear that the eyes are white.
Okay.
In this case, when you notice something abnormal in your child, don't assume anything. You have to come to the hospital and ask opinion of the doctors or medical staff. So it's very important, especially for the children, because for the adults, they can speak for themselves, but children, they can't speak. So you have to bring them to the hospital and we are going to examine them.
Okay. So if you didn't know before, then you just heard that. Cataract can even occur at birth, and that's sometimes referred to as congenital cataract. A child may be born with cataract. Well, how does cataract develop?
What I can say that the cause is unknown. We're here to find out, because if we know exact cause, we can prevent it.
Okay.
But there is nothing like prevention.
Okay.
Exactly. So when it occurs, then we have to treat it.
Okay.
One big challenge that some of the people think that prevention, if you can eat some fruits, vegetables, it will never occur. Still, it's do occur, and especially with the age.
Okay.
It's mostly common in the aged people. But there are other causes also, like during some infection in the eyes, it can also cause cataract.
Okay.
Or at times when you take some medicines, like some steroids. That's why every time we are cautioning about steroids.
Okay.
Some steroids can cause the cataract. So normally when you are on steroids, it's advisable to come for checkup. So we can pick up early.
Okay. And with that, I think I need to bring to the notice of our viewers that steroids may be given in hospital, or you may also be abusing steroids. We have varied names for them now. People call them skin toners, people call them bleaching agents. skin lightening, whatever. Once it contains a steroid, it is a steroid. And not only is it affecting your skin, but from what Dr. Ako is telling us, even your eye is at risk. Don't go anywhere, stay here. Well, before we go into what types cataracts are, Dr. Ako is going to use this model to tell us the different parts of the eye, so that when we are talking about it, you would really try to appreciate it a little, because we need to understand that, so that in the explanation of the surgery, we can also get exactly what they do. So, Doc, let's go through the eye. This is a model of the eye. Let's go step by step.
Exactly. This is the model of the eye,
Okay.
normal eye.
Okay.
So we have, this is the ball, we call ball. When you see in your eye, white part of the eye. So this is the front. This is the transparent part, which we call cornea.
Okay.
So now I'm going to open this model, but it's not what is going to happen in the theater, please. So when we open, in the...
So in surgery, they won't open your eye like this.
Exactly.
He's just showing us what is inside.
So now we have this part, which normally is liquid or jelly.
Okay.
We call this vitreous. Then behind the transparent part, we have this one. When you look at somebody's eyes, you see that the eyes are black.
Okay.
So that's the eye showing here, and its pupils,
Okay.
or iris.
Okay.
The pupil is the transparent part here.
Okay.
This is the iris, which make the color of your eyes.
Okay.
So if somebody's eyes is bluish or greenish, it's because of
This one.
this part of the eye.
Okay.
Then behind here, we have lens.
Okay.
That's the one which we are going to concentrate later on more often.
Okay. Everything about cataract is about the lens.
About the lens.
Okay.
Normally, when you look at something, the light pass through eye and come at the back here.
Okay.
So before you receive your vision, the light has to pass straight.
Okay.
But normally, when there is problem inside the eye, it can cause your blindness, whether partial or complete total blindness.
Okay.
So in cataract, this part, the lens, become opaque.
Okay.
So when it's become opaque, it's becoming like ice block.
Okay.
So it means when it's the ice block here, the light cannot pass through.
Okay.
So that is why you are not seeing. But apart from the cataract, like I said, there can be other causes causing the problem inside the eye. So if you remove that blocking part of the eye, what is blocking the view, there can still be other causes which will not allow you to see clearly. But that one is other causes. Right now we are talking about the cataract. So what happened in the cataract? With the age, or like with the steroids, like we said, when people use bleaching creams, bleaching creams, like you said, is very common. That transparent part getting opaque. It can start from the outside, which we call cortical cataract. It can start from the center. That one we call nuclear cataract. It can come from the back part of the lens, and we call it posterior capsular cataract. But we are going to decide it when we examine. We know which part of the cataract. For the patients, it's not, yes, they won't know. Their only problem that when they notice that the vision is not clear, they have to report. And the early, the better. So as it starts forming, it will gradually, all the lens become opaque. It will be white, completely white. So at times the patient can look inside mirror and they can see that my pupils are white. So that's the sign. It means it has gone too far. You have to rush to the hospital. So when you come, we examine you and we confirm, yes, this is the cataract which you are having. We have to go to the theater. I have to stress here that the cataract is only the surgical solution. There is no eye drops, no ointment, no tablets can cure it. It's only the curement is the operation.
Doc, thank you so much. I would want you to go over that for us. I mean, for our viewers who are so scared of the surgical theater, some of us, when we see the surgical lights, when we see these gadgets, we are so scared that we don't want to get there. And we want to go for some herbal treatment, want to put some ointment, want to do all sorts of things. Doc is telling us something particularly concerning cataract. That cataract, there is no other treatment apart from the surgical treatment. I want you to emphasize that for us.
Yes.
Whether it's in a child or in an adult.
Exactly. Whether it's in a child or adults, the only treatment for cataract at this time is the surgery. Yes, by all means, there will be some fears and all those ones, but you have to come at first. You have to come and ask the doctors, what can you do? Don't take steps on your own and say, oh no, since this cataract, somebody told me that there is some treatment for that. Please come and ask us whether there is something else we can do.
Spectacles can cure it.
Spectacles can help for a meantime until the cataract will mature completely.
Okay.
But when it's not mature completely, for a meantime, spectacles can be helping.
But when it's mature completely, spectacle
Cannot help.
Certainly you have to operate.
Exactly, exactly, exactly. Then I want to add also, like some people, they will say that I went somewhere and they treated for me. What normally used to happen, some quack doctors used to use some needles to shift this part of the lens inside your eye, your own eye. Okay. Why ideally it has to come outside of the eye. When it's inside the eye, with the time, it starts breaking and melting and create a lot of problems inside the eye, and then you are going blind. That one, there is nothing we can do again.
No. So you need to see an eye care giver. An ophthalmic nurse may look at it for you, an optometrist may look, but ultimately, if you have the opportunity, you get to see an ophthalmologist and they will assess it and manage it for you. Who is at a risk of getting cataracts? Is anybody can get, who is at a risk?
Like I said, anyone is at risk. Because at times too, it used to occur when somebody gives you a blow.
Ooh, into
the
eye.
Into the eye. With the time, it can develop to cataract. Because when you make a blow, it touches the lens.
Yes.
And when something is touching the lens, automatically it starts getting opaque. Wow. So like I say, the children can get it. At times during the play too, or at times the cane, like teachers used to cane in on children. If you touch the eye by accidentally, first the eye will be paining, but not at that time. Maybe after 10, 20 years, it can develop to the cataract. Wow. So anybody can be at risk. At times when the infection is on the eye, it can lead to the cataract. Like we said, this bleaching cream, the steroids, it can lead to the cataract. I want to talk about the diabetes also. Okay. Diabetes also can cause cataract. Okay. So normally all the diabetic patients, they have to come for the eye checkup. Not only because of the cataract, but because it's affecting other parts of the eyes. Okay. And it can also lead to the blindness.
So if you are diabetic, target is not just your sugar.
Exactly.
You need to also get your eyes examined all the time because cataract and a lot of other eye conditions can come in there. Doc, now that we know that the entire problem is with the lens, can you take us step by step what you do during surgery to the eye?
First of all, I have to stress here that the surgery we are doing, some people have perception that we are removing the eye, washing it, and putting it back in the eye socket. Okay. Normally, we don't do that. Okay. We don't remove any eye. We don't cut somebody's eye out. Okay. So the surgery, we have different type of surgery. Okay. Olden days, and now we are coming to modern surgeries. Okay. So olden days, we did surgery. We have to open here, and then during the operation, when we finish, we have to suture. Okay. This time we are coming sutureless. We don't suture anything. Okay. Yes, they call small incision surgery. Okay. We don't suture. Okay. So this is modern surgery. And then the newer one is small incision. And we are using some special phaco machine that called phaco emulsification. Okay. At least, fortunately that at least we have it. But unfortunately, we don't have many. We don't have many.
So what you have done today, the surgery you have done today is the
sutureless small incision cataract surgery.
Correct.
So normally what happens, we do some small incision here, and then we open the eye from this place. Okay. So in the purpose of, because we can't do that, we are just showing it, like we are opening small, and then we are removing this lens through this opening. We will just remove it and put new one, the transparent one, back to the place, which will work as your old one.
Okay, so this one then is an artificial lens.
The one we are putting inside is artificial lens, but the one we've removed it, it was natural one. And then we are just closing it, and it stays like that. So that's small incision cataract surgery.
Okay. All right. With this type of surgery that you have described, does the person need to come from time to time for you to replace this artificial lens? How long can that artificial lens last in the eye?
No, it lasts forever. So when we put it, there is nothing you can come and then change it or something. No, nothing like that.
When
we've put it, you don't need to come back again.
Okay. what are some of the complications that can happen during this surgery?
Yes, as all surgeries, there is no 100% that you can say that yes, there won't be any complications because it's a natural organ, and then within the organ, it can be its own problems, which we don't know yet.
Yeah.
And then during the surgery also, maybe something has gone wrong. You might not know what has gone wrong, but there can be some complications. Like, for example, some bleeding inside the eye, which with the time it can resolve. Or maybe the IOL you put inside, it has not fixed it well. It has shifted some way. It also can affect some vision. Or maybe some, as we said, cataract happened and you don't know what happening before the cataract came. So maybe during that time, there was some complications already inside the eye. As you are doing the operation, those complications can come out and affect the surgery. That's the main problem of complications.
Okay. Okay. So what determines whose surgery is successful or whose surgery may not be successful? In other words, what are the predictors of a good outcome of the surgery on the part of a patient? Are there certain things or certain characteristics of the patient that determine if after that surgery they'll get a good outcome?
Yes, it's also depending on how early person has come.
Okay.
Because if the patient has come earlier, at the early stage of the cataract, we are going to monitor that patient.
Okay.
So normally when the patient comes, we examine both eyes, the affected one and not affected one. So when we look at the not affected one and there is no problem, we assume that the other one also supposed to be the same way. Yes. So if we're able to see the back before the cataract will develop fully, because when the cataract develops fully, we can't see the back of the eye. But when the cataract is now coming, we're able to see the back, so we're able to assess it, whether there is any problem or not. So if there is no problem, we assume when the cataract fully develops, after the operation, the vision has to be the same before the cataract. But if the patient comes late and the cataract is already developed fully, we can't access the back. That's where we do not show whether
there,
exactly.
There's a problem there.
And still, again, we are looking at the healthy eye.
Right, yes.
And if the healthy eye is really healthy, we assume that the second one
is also fine.
Exactly. But if the cataract came as a result of a trauma, or maybe diabetes, or person has hypertension, it also creates problems inside the eye, like I said it.
Yes.
So since we can't access the back of the eye, we can't say 100% that after the operation, the vision will be perfect. Exactly. So it's very important for people to come early so we can assess it early.
Okay.
Or apart from that, there are other procedures which can guide us. We can do the ultrasound to check also inside the eye whether there is any hemorrhages inside the eye or detachment of
retina.
retina. Yes, whether there is any other complications. So that one can also guide us.
Okay. Okay. You said that when the person comes early, you don't go to surgery immediately. Sometimes if the person comes early and the cataract is not fully formed, you have to wait for it to fully form. Is that it?
If the person comes early, we have to wait a little bit. Because unfortunately, for that type of surgery, we need phacoemulsification, which I said we are short of. It's just few machines we have in country, yes. Therefore, we have to wait until it's fully matured. Because when it's just, we call it early cataract. One is early cataract, it's very soft. So when we are doing the type of the surgery, it's breaking inside and we are not comfortable with it, to removing it. So when they come early, like we said early, we have to manage with the glasses. So we are going to do refraction for you and check whether with the glasses your vision can be improved. And most of the time with the glasses, the vision will be improved. So you wear your glasses until we monitor and tell you at this time we have to do surgery. And by that time, too, the glasses will not help.
I want to find out in your practice, have you encountered situations where you have gotten to the point where you think you have to do surgery and the people are afraid to do the surgery?
Yes, we have that situation a lot. So we are trying to convince the people to come and do the surgery because, like I said, there is no any solution. And so, yes, because people have at the mind that I am blind, but maybe something happened and I will be cured.
Yes.
But since you already have cataract, like I said, nothing can happen that you will see with that eye.
So we are still discussing cataract, and I want to find out after cataract surgery, how long, because we notice that all the patients are going out with their eye covered. How long are they going to keep this eye covered? When do they open it after the surgery?
No, they're not going to have the plaster on the eye for a long time. The following morning, we are going to remove the plaster and then we will see the outcome of the surgery. So if the surgery is successful, by all means, they have to see something with that eye.
Even just tomorrow, immediately you
Exactly,
they
exactly. They should be able to see something.
Okay.
After that, we are going to give them some medicine. They are going to use the medicine. And as they are using the medicine, the vision will be improving more and more and more if there is no problem inside the eye, like I said earlier.
Okay. So what other precautions do they have to take to ensure that they don't cause any complication? Because I'm sure they don't stay in hospital for a long time.
Normally, we don't admit here, but
So
in
after
hospital,
they
used
do.
to admit.
Okay.
We don't admit, or unless the person is coming from far away, and it's difficult for him to come for checkup the following morning. That one we admit. We don't
What
admit.
can they do at home? What should they not do so that they don't...
Yes, before the surgery, we are taking them through the guidelines, what they're supposed to do after the surgery. So that after the surgery, normally, they're not supposed to bend down so that it will not create pressure on the eye. And normally, somebody's supposed to be helping them in the house. For example, to bathing, there is not like they have to carry some heavy things, chew hard food in the house. All this is part of it can create complications. So therefore, before the surgery, we have some guidelines. They are going through that guidelines. So the following morning, after they're removing the plaster from the eye, they have to follow that guideline at least for 1 or 2 months.
Okay.
It's depending how they will come for checkup. We will look how the eye look like. They will be guiding them that yes, now everything is fine. You can go back to your normal duties.
Okay.
And normally after the operations, we advise people, those who are workers, we give them excuse duties so that they rest in the house and be looking after the eye.
Okay.
So those who are engaged in duties, they shouldn't also afraid. They should come. We are giving excuse duties
so that they can rest.
They can rest and take care of the eye.
We are seeing some needle going into the eye. Exactly what is happening there?
Yes, that was before the operation. We have to give anesthesia to anesthetize the eye. During the operation, the eye will be stable and the patient will not feel any pain. So that was anesthesia. And normally that needle is not going inside the eye, so that the people will not understand that, oh, they are going to put needle inside my eye. No, it's going under the eye, between the eye and the bones. And then we are putting some medicine there to keep your eye painless.
Okay. If you're a regular follower of this program, anesthesia is not strange to you. You have heard about general anesthesia, you have seen spinal anesthesia in some of our episodes. So this is a form of anesthesia for the eye.
Local anesthesia.
Local anesthesia for the eye that they put there, but it is not puncturing into your eye that you are so scared that they would make a hole in your eye. Yes, and what's the role of this fire that we are also seeing in this surgery?
Yes, it's also part of the surgery. It's just that hot point which we are using to stop the bleeding. Some small bleeding used to occur during the operation. It's normal. So because it's not too big, we use some small cautery to stopping that bleeding. It's something like geothermite. So we can also use geothermite, but I prefer this one. All
right. That is the surgeon's preference. Thank you very much, Doc, for explaining all of this to us. We are grateful. Sandra Ekia Asantoa wants to know how often somebody can visit an eye specialist. If you are not sick, your eyes, nothing is wrong with you. If I get your message, well, Sandra, I just want to know, I'm well. Do I have to go and visit an eye specialist, and how often do I have to do that?
Ideally, every year, people have to come for eye checkup when you don't have problems.
Okay.
But if you have problems, by all means, you have to come often and listen what doctor will tell you. When is your next visit? But some people, because my eyes are fine, they won't come.
I can bet my cameramen here, none of them have seen an eye specialist in the past 5 years. All of us need to see eye.
Exactly, because apart from the cataract, there are other eye diseases which we call silent blind condition. I just want to mention briefly glaucoma. It's a silent blindness condition. It won't give you any warning. When it gives you warning, it means you are already blind. So that's why sometimes some people, they think, oh, because I'm not seeing, maybe it's the cataract. But you can be wrong. It can be any other problems, including the glaucoma.
The program is still the OR Show, and I'm Dr. Titus Bayu, and it's my joy and delight to have served you with such healthy health information. Before we wrap up, I want your final words to our viewers, taking good care of their eyes. And if you have a final word on cataract, you can add it.
Yes, the final word, I encourage everybody to come for eye screening. Even if you are not sick, like I said, please, everybody should come and check their eyes once a year. And if you have any eye problems, please don't go to the nearest pharmacy. Come to the eye clinic so that we examine you and prescribe the medicine which you need. Because at times you can go to some drugstore, you collect some medicine, and it is rather worsening the situation. Because we have equipment before we examine your eyes and see what is happening on the eye. It's not any medicine can help in that condition.
Wow. So, Doc, I'm very, very grateful for making time to take us through all that we need to know about cataract, and I'm sure we have all learned very, very well. If you didn't take anything at all from the oral show this evening, I think what you need to take home is that even if you are not sick, as part of an annual checkup, visit an eye care center. Talk to an eye caregiver. Let them look at your eye at least once in a year. Don't forget, we talked about cataract, but like she said, there is a silent blinding condition like glaucoma, which may not give you any warning, but will get you blind. Thank you so much for making time to watch the show. We'll come your way the same time next week with another exciting episode of the OR Show.